Hello, welcome to my YouTube channel. I'm Dr. Vandana Bansal from Arpit Test Tube Baby Center, Prayagraj. So here we are discussing that what are the myths regarding IVF. There are a lot of myths and the misconceptions regarding IVF treatment. They need to be cleared before you go for IVF treatment. The first is that people think that IVF is very costly. It is not so. If you compare any other treatment like the joint replacement and the heart valve replacement and neurosurgery and other robotic surgery, the IVF is very, very cheap. In fact, in India, it is very cheap. The normal IVF will cost anything from the 1.5 lakh to 2 to 2.5 lakhs, which is, equal to the one joint replacement in the body. So, IVF is these days has become very cheap and affordable treatment in India. It is no longer a very costly treatment. Secondly, the people think that the IVF treatment is very painful and cumbersome. It is little lengthy and it requires the cooperation of the patient and involvement of the couple also, but it is not at all painful. These days, even the type of the injections they have come, and they are almost painless and people easily can have them. So it is, and the pickup procedure and the ET is also done without anesthesia. So I can say that the IVF treatment is almost painless. And if there is pain, very slight pain just of injections, and that also can be minimized with the help of the pain gel and the sprays. So I can say that IVF is a almost painless procedure. The third is that the people think that once I have IVF, always I have to go for IVF. That means that they think that if they have undergone IVF, they cannot have natural baby or natural pregnancy after that. But it is not so. It all depends upon the cause for which the IVF has been done. Many a time I have seen that I have done IVF and the second baby they have conceived on their own. So if your tubes are properly damaged, then of course you cannot have. But if suppose you have undergone IVF for any other reason like less ovulation or any other reason which is correctable, so in such cases you can have a natural pregnancy after IVF. The second pregnancy can be normal or the natural pregnancy can happen. So then the people think in IVF, the people always ask for a guarantee, that 100% guarantee you have to give. It is not so. See, the IVF is a treatment where nothing is possible. We are not doing, you are not getting anything, then you are going for IVF. That means where there is a 0% success, you have to compare with the that. So getting a baby is getting a new life. So that is not possible. The life and the death is not in the hand of a doctor anymore. It is in the hand of the God. So the doctor can only try, we can try, every IVF has some success rate. And if you go for 3 attempts of IVF, almost if no such cause is present, you can think that 90% success rate is there. But still 10% still are the couple, they cannot get pregnant through IVF. That we come to know when we are undergoing first, second and third cycle. We come to know, okay, this patient has no chances for the fourth IVF attempt. Otherwise, the people can go for the fourth, fifth and sixth attempt also. It depends upon your resources, on your patience and how much money you can have, you can give for this treatment. The last myth is people always come to me in the last, when they have tried everything. Uh, People come to me with 10 IUI failures and at the age of 40 years, and they want to have their own child with their own eggs because they think that IVF has to be tried when everything has failed and it is the last resort. It is not so. IVF is a method to complete your family. And when should you complete your family? When you are young. That means between 30 to 35 these days. Ideally, it should be done below 30, but maybe it is not possible in this era. So at least before 35, your family should be complete. So that is the time you should also go for IVF, preferably around 30 to 32, you should complete. and if not possible, certainly below 35, because after 35 your fertility goes down and the chances of having a baby with your own eggs goes down. So IVF is no longer the last resort. It is a very effective treatment to complete your family. And when you are serious about completing your family, it should be done early in the course, when you have not wasted your time, your age, and your money in the irrelevant procedures which were not needed. So IVF is not a last resort anymore. Thank you very much for watching my YouTube channel, and please write your comment in the comment box and subscribe the channel.